Hi, my name's Ashley. I'm a medical assistant at MDLSV.
And I'm Michelle.
And being that May is Melanoma Awareness Month, we wanted to share with you a personal story as to the importance of skin cancer screenings. So, I have worked here at MDLSV for a year, and while I had a history of atypical moles, I have always kept up on my skin cancer screenings. And the beginning of last year, I got a skin cancer screening. I was cleared. There was nothing to be worried about. And I had my 29th birthday on October 3rd, and I was off that day. I came back into work, and I was sitting in what we call our clinic area, and Michelle was standing up next to me talking to me. And in the middle of our conversation, she stopped me, and she said, "What is that?" And
there was a really dark mark you could clearly see in her hairline, and it was really little. It was probably about 2-3 millimeters, and it just looked like a black flower drawn with a Sharpie almost.
So that was something I had never seen before. And so we pulled Dr. Margaret Weiss and Dr. Robert Weiss aside, and we asked them to take a look at it, being that this was something new and something that was very dark. And when they looked at it, they said, "This is very atypical. We should really take a biopsy of that." So of course I was on board, because I understand that if a physician, especially dermatologist, notices a funny lesion on you, you should definitely follow through with getting a biopsy, because then you'll know exactly what it is. So we performed the biopsy, and it came back as melanoma in situ. So I work in a dermatology office, and I'm helping with patient care, and we're doing skin cancer screenings all day long, and all the while I didn't even realize that I personally had a melanoma on the top of my head, because I can't see.
And it was in 3 months that it just appeared on her scalp.
Yeah, because my skin cancer screening was clear just 3 months prior. So we did the biopsy. We found out it was a melanoma, and then we needed to decide what the next step was. Mm-hmm. Well, it's something called an excision. You do a wide excision, and it's got to be a certain amount of millimeters around the lesion. So of course I followed through with that. We did the excision, and I had stitches for 2 weeks, and then when we took the stitches out, everything had been healing well, and it's healed for the last 6 months ever since. But I tell you this story because it's very important, especially even if a family member notices something. Sometimes we can't see parts of our body. Sometimes we don't notice that something's changed. If somebody points something out to you, or if you notice something funny on your skin, you definitely want to get it looked at, because even if you just had your skin checked a couple months prior, there can still be something that can be very serious that needs attention. And so that's why I share my story with you. I was very lucky that I happened to be having a conversation with Michelle about my vacation the week before, and that she was observant enough to notice that there was something in my hair. Had she not done that, then, I might be telling you a different story. So thank you for being attentive.
Anytime.
And since we're discussing this, we wanted to discuss the things to look for in moles or anything on your body.
So when you're looking through your moles, you want to make sure you're looking for asymmetry, border, color, diameter, anything 6 millimeters or larger, and anything that is evolving. So your A, B, C, D, E's. In most cases, people find their own melanomas, or their partners find theirs, so it's very important that you do your own self-exams. Melanoma is the deadliest type of skin cancer. If caught early enough, it can be treated, but if you left it untreated, then it can become more invasive and travel to other parts of your body.
And it's important to know that if caught early, the prognosis for melanoma is 100%. The cure rate is 100%. And luckily, mine was caught when it was caught as an in situ melanoma, which thus means my prognosis is 100%. Had it been a few months later, or had we not seen it, I could be in a very different position. So I'm very glad that I worked here, and that Michelle played the part that she played in, pointing something out to me. Even if you notice something on one of your loved ones, just point it out. It can't hurt, and definitely get it checked.